Hello, everyone. Welcome you all back to this wonderful evening today. We have an interesting discussion today. We, as doctors, you need to be working on medications. You need to be good in all-round skills, especially in drug calculations as well. So that's what we are going to do today. As usual, we'll have a discussion and a talk by Dr. Abhishek as well as by Abhirami. And then we have a guest lecture from a senior medical director who will going to give you some tips on interviews. And then you'll be allocated to your room where you will be doing things with your tutors. So you are almost on the last stage of your race, and your inspiration should be all your tutors who are on the other side. And hopefully one day you will also be coming back and helping others. So with this, I hand over to Dr. Abhishek to continue the day.
Good evening, everyone. My name's Abby, and hopefully, you know who I am by now. So, welcome to your fourth lesson, and today it's on data analysis. I'll just wait for Priya to share the slides. And today, what we're going to do is talk about data analysis and why it's really important as a healthcare professional. So, today I'm joined with Abarami as well, who'll also be talking through rest of the slides and the actual data calculations and the interpretation as well. Okay, so let's begin. So we're going to look at data interpretation and why is data analysis important in healthcare and what does it actually mean? So what this involves is it's looking at like assessing patients and the patient's actual clinical data. So it could be their vital signs, it could be the medications they're taking, and it helps us to make informed decisions about them. And the relevance of this is to understand, okay, so when we get some data, be it their test results, we need to know, okay, what that means and why it's important and how we can pin it with the clinical picture. So data in itself is just a small segment, but understanding its use with the clinical picture is what makes a difference. And the application is, well, it helps with the decision making, it helps with the patient safety, and it helps with good resource management. Next slide, please. So the skills required for good data interpretation includes, but not limited to, is analytical skills. So the ability to break down complex data for clarity, and especially to do that in a high pressured situation, and the accuracy. So on, using good methods, good reliable systems to understand what that data means. And then using it, of course, in the whole clinical picture, as I was mentioning earlier. And then most importantly, communicating that data with individuals who may not be familiar with that data type. Okay, so communicating it with the rest of the healthcare team and especially, of course, to the patients as well. Next slide, please. So the NHS values and their role in data interpretation. So all the data, of course, is patient-centered. So it allows for the care to be tailored to the individual. So we can look at infection markers, white cell inflammatory markers, and see, okay, how's it relevant to the patient. It allows for accountability. So it allows us to know if our care is working or not, and it allows for safety. So data is one kind of value which shows what we're doing, if it's working or if it's not working. Next slide, please. And the importance is, okay, so in thinking about compassion and respect, so the data really allows for empathetic care. So we get information about the patient. So data isn't just numerical, it's also information as well. And when we have data, we need to make sure we handle it in an ethical and integral manner, okay? So keeping that data to individuals who are pertinent to the patient's healthcare pathway. And the excellent aspect is, well, when we analyze data, we can do audits, we can do quality improvement projects to really alleviate the patient's position and improve the patient care pathway within the NHS. Next slide, please. So the key formulas when it comes to data interpretation and healthcare are BMI calculations, dosage calculations, percentage changes, and I think we'll be working through some examples from the next slide onwards. So I'll pass it over to Abarami for the examples and calculations. Next slide, please.
Yeah, perfect. So, hi guys, I'm Abirami, I'm a third year medical student. So yeah, we're just gonna go through a couple of examples and you guys can practice as well with your tutors in not too long time. Just a quick note on conversion. So I think a very easy way that people can trip up is conversions. So I would say, take a picture of this. You should get the slides after, but these are the ones that you should know. If it comes up in an exam or comes up in your MMI, you don't want to trip up and give it in the wrong units. But yeah, this is just really important to make sure you check the conversion and what they want the answer in. So just going to run through a couple of examples and how to do them, and then you can practice them with your tutors in a bit. So next slide, please. Yep, so the first one, so this question, I just want to say something before, you're not expected to have any sort of clinical knowledge for a MMI or for a medical school interview. It's more about how you interpret the data. So even if you get a question and it's talking about diabetes, or for example, this one's about hypertension, don't worry if you don't know anything in terms of that condition, but it's how you interpret it. So this question, so a patient's blood pressure readings were 140/90, 138/92, and 142/89 over 3 appointments. What does this trend indicate? So again, if you go to the next slide, what we want in the answer, so you'd be given like the data and you'll be told what the data means, but it's how you kind of convey that back to the examiner. So you want to say that there is a persistently high blood pressure, and you want to kind of spot the trend. So has the blood pressure gone up and then gone down, or has it increased? So for this one, it has just increased over a certain time. What does this mean for the patient? So the implications. So what could the patient do? So for example, is that lifestyle modifications or changing diet, or will they need some medication started? And again, communication. It's quite a sensitive topic. Some patients might feel a bit upset about this result, or they might feel, they're a bit confused, and it's how you kind of communicate that to the patient, and that's what the examiner is really looking for. In terms of anything clinical, you will get given that, so don't worry about that too much. So if we go to the next question. Perfect. So the next question is dosage calculations. So I think Abhishek has there was a slide on equations, so just learn it. So for example, calculate the dosage for a medication if the patient weighs 60 kilograms and the prescribed dose is 2 mg per kg. So quite a simple calculation and one that does come up quite often. So if we just go to the next slide. Yep, so we see the answer. So you just do 60 times 2 mg, which will give you 120 milligram. So again, just practice these ones. It does come up quite often. And again, look at units as well. Is it milligram? Is it grams? Is it kilograms? And just be quite specific in that. Again, in terms of the relevance, this is really, really important. A lot of medications they're dosed by weight, or they could be really toxic if you give too much, or they might not give if you don't give enough, it might not be therapeutic. So it's really, really important to avoid these medication errors. And again, it aligns with the values, NHS values of safety and patient safety. So let's go to the next question, which is question 3. And don't worry, you should be able to practice this, so don't worry if you're not too sure yet. So question 3, again, very common one. This is about looking at percentage change or percentage difference. And again, you should have done this probably during GCSE, but just kind of like a refresh. So a patient's weight has increased from 70 kilograms to 77 kilograms. Calculate the percentage increase in weight. And again, this is just another calculation, another equation that you just have to learn, which is percentage change. So we go to the next slide. So that will be the answer. So all you do is you find the difference in the two weights, so 77 minus 70, and you divide it by the original weight, which was 70. Again, if they ask for a percentage, you always want to times it by 100 to get that percentage. So that's 10%. Again, examiner might give a follow-up question of, okay, what is the significance of this? And that's where you want to look at things in terms of weight management, how that affects the patient's health, what can they do? So is it more like lifestyle changes and things like that? And again, this is quite a sensitive topic in terms of weight. So how would you communicate that effectively to the patient? And also a really good one to bring up public health as well and public health campaigns such as weight loss. And the final question, so just the next slide, please. So this is mortality rate calculation. So I'd say this one is maybe not as common as the other ones, but again, it's just an equation that you need to learn in case it does come up. So in a population of 5,000, 30 people died of a disease in 1 year. Calculate the mortality rate per 1,000 individuals. So you just go to the next slide. So this is how you would answer it. So that formula is on the top. I'm not too sure if that was actually on the PowerPoint for formulas. So again, just learn this one. It's number of deaths, which was 30, divided by the total population, which is 5,000. And then you times it by 1,000 to get how many people per 1,000. So that gives you 6 people per 1,000. So yeah, if you have any worries, any questions, just let us know and we can go through it, or let your tutor know. And again, yeah, I think Abhishek's just gonna go through the last slide, and that's just a bit of a summary.
Okay, next slide, please. Okay, so don't be worried by, the name does sound a bit intense in the data analysis and interpretation. So there's nothing to worry about. The maths is normally quite simple. But the key difference is to understand is what those numbers mean and how to actually communicate those numbers with the healthcare team and the patients in a patient-centered manner, upholding the NHS values and incorporating aspects like how we can use those numbers to improve their lives and enhance their healthcare. So make sure when you're discussing these numbers, and if you have the opportunity to, always be reflective and do it in a patient-centered manner. And hopefully you get to practice all of this in your breakout rooms. Thank you.
Thank you, Abhi and Abhishek and Abhirami. That was very helpful, and that would have reduced people's anxiety. People always get worried about calculations and things like that. But hopefully, after the end of next hour, you will be more confident. So we next move on to our second part. I am really honored to have Dr. Arun Prasad Chidambaram, who is a consultant forensic psychiatrist, and he has a master's degree in psychiatry as well, as in addition to his fellow of the Royal College of Psychiatrists. He started his psychiatry career in the NHS in 2004 at Liverpool, and over the last 21 years, he has worked in numerous trusts, helping so many people, as well as being in the management role. He has a diploma or a certificate in healthcare leadership and has been in the management role for quite some time. He was the ex-medical director at Derbyshire Healthcare NHS Trust and currently the chief medical officer in Greater Manchester. So he will be the right person to talk to us over the next 10 minutes on giving you tips for interviews. I'm also very proud to announce that we are releasing our third book on interview techniques, and Dr. Arun Prasad will be releasing it today. Over to you, Arun.
Thank you, Dr. Anand. It's really a privilege to release this book that's going to be hugely helpful for aspiring medical students. I had a look at the book. It's very structured. It's 49 pages full of very useful information. And looking at the book, it looks like it's not just going to be useful for getting entry into medicine. Some of the principles will hold good even when you finish medicine and when you get into higher training. And even when you get into job interviews, some of these principles still hold true. I think the STAR technique has been mentioned in the book. That's a technique that's used in consultant interviews and even senior management interviews. Even this year, I did an interview, so I had to do practice. So the practice never goes away. So I was hoping to share some practical tips based on the interviews that I've done, both on both sides of the table. Because when you have to get ahead in your career, you need to face interviews all along your life. So I think those techniques and competencies are required all the time. But equally, I've been in numerous interviews where we appoint candidates for different roles, and we also select candidates for higher training. So these principles are the same. Um, and practice is very important. So it's not just about um, answering on the hoof, it's creating a database of lots of examples based on your career, based on what you've seen, professional examples of managing challenging situations. And the other one is how do you manage conflict? I think you just need to have a database of 10, 20 different examples. And sometimes you can also use the same example for a different question. It all depends on what the question is and how you want to frame the answer. And again, practice is quite important. So you can practice with your peers. And even if you don't have a peer on a particular day, you can record yourself with your mobile phone, and then you can watch it. I think that will give you valuable tips on what are the little things that you need to change. And over a period of time, you can change that. And the other thing is to use the Microsoft tools. So if you look at the Microsoft Office, the PowerPoint app will actually ask you to rehearse the PowerPoint slides. So let's say you've got a few answers, you can put that in a PowerPoint, and you can use your mobile phone to actually recite that slides. And because it listens, it'll actually tell you how many pauses you make, where you need to speed up, and you can also time your responses. So some of the questions like why do you want to get into medicine? They are very key questions, and it's better to practice the time as well. Um, and the other important message is to make sure that you don't have more than three messages in any answer. Um, I think this is quite important because human brain can't process more than a few key messages. If you try to pack in a lot of messages, it's likely to be lost, and the impact of your answer is going to be less for the recipient. So think about three messages that you want to convey. And sometimes it's better to summarize the answer. So let's say you're giving A, B, and C. Once you finish the A, B, and C with some elaboration, you can say that you've stated the A, B, and C. Um, repeating the content is not such a bad idea, especially when the answers are lengthy. And the other thing is to make sure that you have eye contact. And if you're in a panel interview, you need to make sure that you keep moving your gaze towards all the different panel members. I know it can be nerve-wracking having a panel interview, and depending on the number, it can be even more nerve-wracking. But sometimes you need to think that you are the expert. So the interviews are not about testing your knowledge. It's more about they want to know you as a person. So if you have that mindset that you are the expert, because none of the people sitting in front of you will know you, you are the best person to know you. So you know all the answers. They don't know the answers. So keep that at the forefront of your mind. That will give you confidence. And this interview is more about presenting you as a person, because all the technical skills that's been tested. Interview is more about how do you come across as a person. Are you able to work in a team? Are you going to solve problems? Or how are you going to be in a team and actually deliver patient care? So that's what interview is about. And just need to Sometimes smile if you can. I think that makes a big difference. It makes you a person. And in the examples, it's if possible, you need to bring yourself to life. Who are you as a person? So that needs to come through in an answer. The most often, the most the common pitfall is we get into the technical details of answering the question in a perfect way, and sometimes we can easily get lost in how you pitch the answer with lots and lots of details. I myself have been guilty of that. So over a period of time, I got feedback, and then I've started focusing less on the content and more on the audience. This is more about presentation skill, but it's also about interview, how you engage the audience. So it's probably focusing on the style, not just the content. And the other thing is to think about preparing for the interview. So you need to make sure that you're not tired. You arrive in the venue, or you make yourself prepared ahead of the interview. The last thing you want to do is to feel rushed, or the panel interviewers thinking that you've just come in a rushed way. So you just need to give yourself time so that the nerves are not visible, and you present yourself in a calm and collected way. And you also present yourself in a very confident way. So it's all about eye contact, it's about preparation, and it's about giving yourself some time before the actual interview so that any kind of last minute rush is not affecting the interview. And again, lots of practice. You might want to practice yourself sitting in front of a mirror, or you might want to take a video of yourself with your mobile phone and then watching it, or you can use the Microsoft PowerPoint app to do some rehearsal. And the coach in the PowerPoint will actually tell you where to improve and how to improve. It also picks up on the inflections, whether you're too loud or your volume is too low, and whether you are picking up speed in some areas and lagging behind in some other areas. So practicing it twice or thrice before the interview is such a good idea that it just keeps improving as you respond to the feedback. So interview is all about presenting the best version of yourself. Everybody wants you to do well in an interview, whether it's a panel interview or MMI. And just be the best version of yourself. Make sure that you've done the preparation. And again, think that nobody in front of you knows the answer. You are the person who has all the answers. So if you keep this in your mind, you'll feel very confident, and you'll be able to do justice to all the hard work that you've done. So that's all I wanted to say, and I'm happy to take any questions. Hopefully that was helpful.